Foundations Wellness, we are celebrating May as Lyme Awareness Month. So you might be wondering, why do we need a Lyme Awareness Month? That is because of how important it is to get your diagnosis and your treatment in a timely manner. So let's just talk about the difference. What is the difference between acute, which means you just got it, a brand new case, versus chronic, which means you've had it for a long time? There's a big difference. So I think one of the biggest misconceptions about Lyme disease is that it's easy to diagnose and easy to treat. And yeah, if you're one of those people who are super lucky and you got a bullseye rash around your tick bite and your doctor picked up on it and gave you 3 weeks of the proper antibiotics, yeah, sometimes for those people, they can get better quickly and just have no problems at all. So that's acute Lyme disease. Now, if you're like me or like millions of other people who either we weren't tested properly or we weren't tested at all, or we got a false negative on our test, we can go years, if not decades, with Lyme disease. And at that point, it's called late stage Lyme disease. So in other words, yeah, you end up with all the symptoms: the fatigue, the heart pounding, the headaches, the GI problems, the anxiety, the depression, the horrible insomnia, the joint pain, the muscle pain, the nerve pain, the neuropathies. The list goes on and on and on of things that you can have with chronic Lyme disease. And since I was one of those people who developed that thanks to the difficulties in testing, I know what it's like to walk that road. So I'm going to talk about the testing for just a moment. So why is the testing so problematic? That's because if you're going to test for Lyme disease, the best time to test for it is between 4 and 6 weeks after the tick bite. But many people will, in their anxiety, get tested right away. And if their doctor really is not familiar and test them right away, their body hasn't even made the antibodies yet that you're looking for, so you're going to get a negative. Conversely, some people don't test for it until months later. And by that time, Lyme has already completely suppressed the immune response, which is what Lyme disease does. So if it's suppressing the antibodies that the test is looking for, you're not going to have any. And it's going to show completely negative, even if you have Lyme disease. So it's a real problem. And so this is how people end up being sick for a long time. So if you have come to the conclusion that you think you have Lyme disease, or you know you do, and maybe you're one of those people who took the antibiotics but it wasn't effective enough and so you ended up with chronic Lyme disease, or you're like me and you just weren't really ever tested properly to begin with, we have treatment choices. This is the exciting part. Most of us think of Lyme disease and we think, well, I need antibiotics, which is what I thought too when I first realized I had Lyme disease. And in the end, it turns out you can take antibiotics, and for some people that works okay. It tends to make them feel better for a while if it helps them at all. But then they will, as soon as they go off of the antibiotics, they feel bad again. And this is why it can be so complicated to treat it. So the good news is that many people in the holistic world have discovered the way to get people like you and I well, 100% well, using all natural methods. So I went through a program in New York called the Uprooting Lyme Clinic and learned how to use safe and effective herbal remedies, herbal antibiotics you might want to call them, as well as detoxification. And people are getting well. People who have been sick for 30 years, 40 years, 50 years with Lyme disease are getting their life back. I was sick for 15 years, and now I have great energy from morning till night. I have no more pain. I sleep good at night. The anxiety and depression are completely gone. A lot of my autoimmune and IBS type things are completely gone. And now I work with people who have this illness, chronic Lyme disease, and there's different things that you can use to help take out this little guy, this little spirochete, the little bug that creates Lyme disease. This is one of my favorite remedies. This is a cutting edge liposomal essential oil formulas that were developed as a result of the Johns Hopkins study that showed that essential oils will take out Lyme better than the top 3 antibiotics. So we have learned how to spin these into liposomes, and that can really help. And there's other herbal tinctures that can help too. The bottom line is there is hope. If you would like more information, please call our office or look us up online.